So this video will give you some important pre-operative information that will help a smooth experience for you during the surgery. Now, the first critical step after a decision for cataract surgery has been made is deciding the type of IOL to be implanted. Let us see one by one what all things are important in this. First, most important point from doctor's point of view is whatever the measurements of the eye that have been taken on the day of the primary consultation, are these measurements satisfactory? Then no further repetition is needed. But if there are some additional tests depending on the type of lens that the patient chooses, or if these measurements are not satisfactory, then patient might have to come on another day for a repeat testing. Second thing important is to find out if there is any other issue in the eye. For example, patient may have some active retinal problem. In that scenario, an opinion might be sought from a retina specialist, and if retinal treatment needs to be done before the cataract surgery, then that is done. The next important point uh, is what type of lens should a patient take. For that to be finalized, it's important that we have views of the patient. So a simple questionnaire is given to the patient, and questions like what are the commonly done activities in a day. That means average time spent on what activities, on different activities are asked. Then how often do you wear glasses? When would you like to use glasses after the cataract surgery? What is most important to you with regard to vision? Whether whether the quality of vision is the most important point, even if that means a patient has to wear glasses, or patient says that a minor deterioration in vision quality is fine so long as I can reduce my dependence on glasses. So these are the four important questions that patient has to answer before a decision regarding what lens needs to be implanted is taken. Now, with regard to the types of lenses available and how to choose them before surgery, there is a separate video that will be provided to you. Now, booking the date of surgery. Once this testing and all this process is over, patient is then given a date of the surgery on the same day, or patient is advised to finish off all the other testing and then fix the date over the phone. Next important point is doing the systemic health checkup. So certain basic blood testing, ECG is required, followed by a physician checkup. These reports have to be sent on email or WhatsApp. Physician advice, if any, has to be strictly followed, and all these documents have to be brought on the day of surgery. Now, with regard to preoperative medication, routine eye drops, if patient is already using them, should be continued. 1 day prior, antibiotic eye drop has to be started 4 times a day, and then it should be given 2 times a day on the day of surgery. Before coming to the hospital on the day of surgery, patient should have a normal routine breakfast, tea, coffee, and a normal bath. If patient is taking oral medications, it should be continued as per the usual schedule. On reaching the hospital, patient has to report to the OT admission help desk. So for some formalities have to get completed, and then patient is admitted in the ward. There is a change of clothes. Patient has to change into OT dress and wear a mask provided by the ward sister. In the OT, the staff will make you comfortable. Any issue with regard to head posture or feeling of cold should be informed. During surgery, you can communicate with your surgeon. If there is any discomfort or pain, so that appropriate corrective measures can be taken. After the surgery, you can relax in bed, can take light snacks. If there is any pain, just inform the sister, and after about 1 or 2 hours, you will be discharged with appropriate post-op instructions. Our best wishes for a faster recovery. Thank you very much.